In this video, I'm going to talk about a common story of failed low back surgery. It's a case study where I'll explain some of the reasons why it might have gone wrong and what can be done to help if it does. Hi, my name's Drew Coverdale, a physiotherapist and author of The Pain Habit. I talk about all things pain, but with a smile on my face. I help patients change and let go. In this video, we're going to look at a common pathway into persistent pain, and that's through failed low back surgery. It's a very common pathway into persistent pain when people only focus on the physical element of someone's problem, and that often means that it creates more problems than it sets out to solve. It's a story that's repeated so many times with so many different physical areas of pain. The more you understand from this case study, the more you might be able to understand about your own pain, other people's pain, and your beliefs about it. This case study is about a 32-year-old man who presented with 18 months of low back pain and leg pain, commonly known as sciatica, where the pain goes all the way down the leg. He described this as starting when he was lifting some weights at the gym, but these were weights that he would lift at that level easily and effortlessly normally. But on this one day, he noticed a small pop that he felt as he did the routine. He felt some discomfort with this, but he carried on, and he later described this as stupid because he felt that he should have stopped when he got that sensation and that discomfort. Later that day, the symptoms got worse, gradually increased in pain, and by the next morning he could barely move and couldn't get out of bed. He called his GP, was given painkillers and anti-inflammatories, but several weeks passed and there was no real improvement in his situation. Eventually this led to his GP referring him for an MRI scan, and this showed what's commonly described as a prolapse disc. If you're not sure what that is, if you just visualise a tyre wall with a little bleb in that tyre where the pressure inside the tyre makes a little bulge that can be picked up on an MRI scan. So following that, he was referred to a spinal consultant who reviewed those findings, and he recommended to him that he should have surgery. The operation was to take away the bulging prolapse disc, as that was thought to be the reason for that man's pain, and that procedure took place about 6 months after the initial onset of the problem. When he came out of surgery, he explained that he was told that the procedure hadn't quite gone as well as expected, and he was told that they couldn't quite get all of that disc out that they were trying to do the operation on. He was also told that he might have some nerve damage. The symptoms were no better after surgery, and he actually started developing leg pain about 4 weeks after the operation. He started taking really strong opiates and was up to about 32 tablets of one form or another to control his pain every single day. The pain was so bad that he couldn't return to work, he couldn't go to the gym, he found it hard to play with his children or do anything like simple tasks around the house. He had several episodes where he called the ambulance because the pain in his back and his leg was so bad and the pain would cause his leg to give way. It led to hospital admissions, acute admissions where they helped him control his pain, and then he was discharged again. On one occasion, after one of these admissions, he was assessed by another consultant who actually told him that he'd have got the rest of that disc out. Anyway, because he was still having problems, he had a further MRI scan. When they looked at the findings, the surgery was considered successful. There wasn't any further indication for more surgery. He was advised to continue with painkillers, anti-inflammatories, and it was just thought that the ongoing symptoms were due to inflammation or nerve damage. The only other option was to go on the waiting list for the insertion of a spinal stimulator, which is a little device that's inserted under the skin with the aim of trying to help relieve the pain. This is a really common description of a situation that's described as failed spinal surgery. The decision to do the surgery was based on the clinical presentation and the MRI scan, and yet doing the procedure on what was found on the MRI scan made no difference to the patient's pain, and in fact the symptoms got worse, as before the operation he didn't have any leg pain. Often what is found on an MRI scan is there before the person even complains of any pain. Many changes are found on x-rays and MRIs of people who have no pain at all. Those changes might have related to an episode of pain in that person's life that they've fully recovered from. It's just a scar on the inside, and there's plenty of scars on our bodies on the outside that don't hurt. So why would scars on the inside hurt anymore? If that pain was due to a physical abnormality on the inside and that's been corrected, then why isn't the pain gone? If there was nerve damage, why did it start 4 weeks after the surgery? There are clues in why this happened in his presentation and in some of the descriptions given to him about how the operation went. There's lots of fearful thoughts and concerns about what he was told. The operation didn't go as well as expected. We didn't get all the disc out. We think you might have nerve damage. And then another surgeon offering a different opinion saying I would have got the disc out. All of these statements become cues and have the possibility to be linked to pain and influence it. When we only focus on the physical aspects of someone's pain, you miss the opportunity to discover what other things might be contributing to that person's problem. Remember, pain is all about protection. Pain is about the person's brain and body telling them to attend to themselves. It's not an indicator of damage, and it's not an indicator of how much damage has been sustained. It's magnified by the emotions that people are feeling. If there is something in that person's life that is pushing them so hard, of such an emotional intensity for so long, and they're carrying on with it or ignoring how they feel about it, the body and brain can trigger pain from that level of overload. And that pain is as real as any physical pain from a physical injury. If we misinterpret that pain for only physical injury, then we're looking in the wrong place for the cause. We potentially put that patient through wasted and ineffective medical interventions, destined to fail. We also risk, as happened in this case, pushing the patient down a path leading them into persistent pain. So if it isn't physical damage alone, what else could it have been? Well, that physical area you felt the pain is relevant. If it's an area of damage, why would that be the part of the body the person complained of pain? Well, you remember every single pain you've had in your life, but some are more sensitised than others because of the level of emotion attached to them. And if emotion becomes attached to a pain, there's the potential for emotion to fire that pain. So when you look at what happened to this gentleman before he started complaining of any pain, you might find some situations in his life creating an emotional charge that he struggled to deal with. And what became apparent, that he was estranged from his partner, he wasn't getting access to his daughter, he was starting a new business, he was working full time at the same time whilst he tried to build up his self-employed business. His stress relief from all these things came from going to the gym, but pushing himself really hard in the gym to naturally make himself feel better from the stress that he was feeling in his life. He'd been used to pushing himself really hard in life, and he'd actually been quite a high level athlete, so it made sense to him to use that as a mechanism to reduce his stress. He exhibited lots of personality traits consistent with people who develop persistent pain, and I'll talk about those in another video. The entry point to the event is key. He was already at a high level of stress, and his down buttons from that were exercising really hard. Now that's stressful even though it's stress reducing. It's a paradox. Exercise can help reduce stress, but if you have to exercise so hard that it potentially creates pain, then you've lost the stress reducing capabilities of that activity. If he could no longer do that activity, it creates stress because he can't do the activity that reduces his stress. That adds more stress to that which was already in his life that probably triggered the initial pain. The pain was stressful, the failed medical interventions were stressful, his life was stressful, the perception of any movement in his back was stressful, what he'd heard from the doctors was stressful, the outlook on his life was stressful, and any other potential threat to his back exacerbates his symptoms. He was stuck in the chronic or persistent pain cycle. It is so important in this situation when the person has a belief that all of their symptoms are due to that surgical intervention that's gone wrong, or the problem that led to the surgery, the physical aspect of it. It's so important to see the link between the pain that came where it came, related to those areas of damage, but the emotional link that is established to that particular pain. Remember, when a pain fires with an emotion, it wires to that emotion. That means that physical pain has the potential to be influenced by the emotion attached to it. If that emotion reaches a level in someone's life that they are not attending to themselves in that situation, that they are enduring, that they are persevering with, and when you understand the personality traits of people who are likely to get chronic pain, you'll see how once that threshold is met or passed, their brain or body finds some way to alert them to attend to themselves, and it does it with pain. And that is the point at which that person will start to feel pain. And which out of all of the thousands of pains that that person has ever suffered will they start to feel again? It's the one where the context is appropriate, and it's the one with the emotional connection to it. Once this link was explained to him, and he was reassured that the findings on the MRI probably there before the event, totally pain-free, maybe a marker of where he had had some pain in the past, and that the onset of the pain was due to the overload in his life, he started to understand his situation. The pop on that day was simply the straw that broke the camel's back, and yet he continued again. The pain increased a few days later, not in the moment he felt that pop. When he looked at the overload in his life and what he was facing, enduring and carrying on with, and the pain represented that this was simply too much for him to sustain, he was ready to make some changes. In resolving how he felt about his pain, removing the fear, starting to listen to his body and take back some control, once he realised he was not as badly damaged as he initially thought, he started to attend to himself in a gentle and consistent way. He started to use some simple techniques consistently. He listened to his body, he paced himself, and he made a complete recovery. No back pain, no leg pain, no further surgery, no spinal stimulator, no further pills, complete recovery. His story is typical of many of others with failed low back surgery. You'll find a physical element in those people, but what you'll also find is before that pain got worse, you'll find a situation in their life that they considered stressful. That stress might be something they enjoyed but overdid, or it may have been something that they found very difficult to cope with, and it may have continued beyond what they can cope with to the point at which they experienced physical pain from it. It can seem a very strange connection to consider when there's a firm belief that the pain can only be physical, but more and more evidence is showing this link. It was possible for him to completely recover from persistent pain. It's possible for all of us, and it's possible for you. My name's Drew Coverdale. Thank you for watching this video today. Now take a little bit more time out for yourself and take a step towards your recovery.